Good morning. I'm so thrilled to be here to talk about something that I am so passionate about. I'm especially thrilled to have this time slot when all caffeine receptors are thoroughly saturated, both yours and mine. When I was asked to share with you about near-death experiences in the ICU, I was so excited. And I actually give a lot of lectures to resident physicians. And so I'm in that mode and that skill set of setting about pulling together research and data and prevalence and incidence, and became so entangled in this process of creating a lecture that I became tired, the lecture became tired, and it was one big yawn. And I thought, if it's a big yawn for me, it's going to be a big yawn for you. But in the process of reapproaching it, I realized that this presentation was more than me and beyond me. And as I started to interact with it, I realized that it was a living, breathing thing that wanted to be manifest and wanted to come forward and say something very important to this specific audience and to go beyond that. And that was a new experience for me in preparing a presentation, to enter into agreement with it, to hold space, much as a pregnant woman would hold space for this creature, this being that has agreed to come into the world and to be born. And it was not unlike being pregnant, because initially I was really excited, and then morning sickness set in, and I thought, what have I gotten myself into? And then the questions of parenthood arose, of wondering, am I going to be able to be a good mother to this information that really wants to come forward and wants to present itself to you? And so, doing what any good mother would do, at about week 16, I pulled out Focus 12, understanding that that's the sonogram of the focus levels, this expanded state of awareness. And spend some time in Focus 12, which is actually my go-to. I love that space. I'm very familiar with it. I feel very comfortable with it. It has become very useful to me in a medical practice. And in that space, I began to see the heartbeat of this presentation. I began to see the reaching limbs and the shape of it. And I feel kind of emotional around that, because that was a transcendent moment for me, to understand that this presentation had nothing to do with me, but I was simply the midwife to hold space for it to come into being and to share something important with you. And as it continued to grow, I began to enter into relationship with it and understand what it wanted to be. But it wasn't quite clear to me how it was going to be in its entirety. But it didn't become clear to me what this entity, and I came to understand this as a separate entity that I had the honor of working with, until I met Laurin. Now, I work in 2 ICUs. They're on 2 different campuses, but they are connected. And frequently, after I interact with patients in the intensive care unit and I see them, I will see them in our office, to see them in follow-up and to try to process their experience, make sure they're feeling okay, whatever injury we treated them for, to see that they're progressing. But it's also become an opportunity for me to see if anything else happened of a nature of consciousness. And usually I have time to sit down and talk with them. And 2 weeks ago, I sat down with Laurin, and we're talking about his physical facility and how things are going, how he's progressing. And Laurin, I knew, had had lung cancer. He had been diagnosed about 14 months earlier with large cell lung cancer. And if anyone in this room knows about that particular disease, it's very rapidly advancing. It's not a friendly lung cancer. In fact, it's quite aggressive. But Laurin was in remission. And that's highly unusual, because that is quickly a fatal disease. And so after we had tidied the visit and ended it up, I said, is there anything else you would like to share? And he said, well, can I tell you something that's a little unusual? And I said, always. And he said, it's a little crazy. And I said, I speak crazy. In fact, I'm quite fluent in crazy. It is my native tongue, in fact. And so he began to tell me this wonderful story that happened before he was diagnosed with cancer. He was in a waking moment where he was aware that he was conscious after having slept. And as he was laying there just relaxing in his bed, eyes still closed, this image, a real image, began to form in his field of vision, eyes closed. This had never happened to Warren, and he was mesmerized. And as he began to watch this vision, this shape began to come into form. And he is a laborer in one of our paper mills, of which we have many, and he had no medical context, but he sees this shape come into form, and he has no idea what it is. He thinks it might be a heart because there is something pulsatile running through it that is linear and pipe-like. And he has some artistic ability, so he wakes up and he starts drawing this thing that he's seeing. And then he closes his eyes and wonders if it's still going to be there, and it's still there. And it starts to talk to him. And it said, "Warren, I'm your cancer. What are you going to do about it?" And it was a challenge. And he said he understood in that moment this was something that he could negotiate with, and that this cancer was presenting itself to him as a challenge, wondering what he was going to do about it. Now keep in mind, Warren doesn't know at this point that he has cancer. So he goes to his primary care physician and said, "I think I have cancer. I want a chest x-ray." And I actually know his primary care physician, who has been in practice for a long time and is pretty open. So he said, "Okay, we'll get a chest x-ray." And he had a mass that you could see to the right of his heart. As they got the CAT scan and he visited with the oncologist, the particular oncologist is really good about sitting down and showing them the CAT scans and showing them the nature of the cancer. And he pulled out his picture and said, "It looks like this." He had drawn the anatomy of his cancer, and it was wrapped around his pulmonary artery. So it was inoperable. So treatment at this point in time, once they had a diagnosis, was purely palliative, to keep it under control as long as possible so that he could be comfortable. And Warren instinctively said, "Oh no." So he entered into conversation over 3 months with this cancer. And each time he would go for a follow-up visit, he would draw it. And he would draw it smaller. And he would talk to this cancer. He would argue with this cancer. When he would give up, the cancer would fight back and say, "Not acceptable." And until he was in remission and that cancer was gone, at every stage, he drew that tumor until it was no longer there. And he maintained a state of seeing it not there that he does to this day. And he said to me, "I think that's the future of medicine, that we will enter into a dialogue with our diseases and tell them to get out." And I said, "We're already there. And we've been there for a long time. And as people who practice shamanistic medicine and other traditions understand that we've been there for a long time. It's just that this generation and this culture is just now coming back into an understanding that we could enter into dialogue with our diseases and tell them to get out." But what was interesting is that he had this understanding, this insight that came out of this, that this tumor was a guide. And he said, "This tumor came here to teach me something." And he thought I was going to think it was too far out, which is just not possible. But he said, "I think that they are their own species, and they care about us, and they get together to come down here and to teach us something if we're willing to listen." I'd never heard that said about diseases, but I loved it. I loved it. And I thought, I've arrived at this point 2 decades later from when I started out on this journey with a certain fluency of being able to sit down with patients and talk about this and to bear witness to their phenomena, their growth, and their understanding. But that is not where I began. When I was a medical resident, anyone in this room who's been through any kind of intensive training, not just for medicine, but for engineering, for advertising, for any kind of job, there is an intense period of training and learning, and that's all you are able to absorb at that time. That is the sea you're swimming in, the sea of trying to absorb and assimilate as much knowledge as you can in this finite space of time. And so I was firmly entrenched in my left brain, firmly entrenched in trying to absorb what I would need to be able to go out and practice responsibly on my own. That's when I met Samuel. I was doing an intake, an admission for Samuel. And he was being admitted to the VA hospital for belly pain. We quickly identified that he had a small bowel obstruction. He had an obstruction of his gut. And typically what we do is we admit him to the hospital and give them bowel rest. And frequently it will resolve on its own. But this did not resolve on its own. It continued. And it got to the point of crisis where he needed surgery because we were able to identify that he had ischemic gut. He had ischemic bowel. There was part of his bowel that was starved of oxygen from this obstruction and it was dying. He needed surgery. So whenever I approached him and said, Samuel, we're going to need to do surgery on you, he said, oh no, I'm not going to do that again. And as he told me his story, he said, they did surgery on me and I saw the whole thing. I didn't know how to respond to that at that point in my journey. I was confused and I was still thinking of it in a very finite way. I said, well, tell me more. He said, I was up above looking down at my belly and I saw my whole surgery. So I'm thinking, oh, did something go wrong with anesthesia? I'm thinking, still very finite. I said, did you feel any pain? He said, no, I didn't feel any pain, but I saw the whole thing. I saw them open my abdomen, I saw my guts, and it freaked me out. I will never do that again. Now, understanding surgery, and the anesthesiologist among us can speak to this, is that there's a field that blocks the vision from the surgical field to preserve that sterile space. And so you can't possibly, when you're lying there, see your surgery from that vantage point. I went to the medical records, and that time we didn't have electronic medical records. We actually had to go down to the bowels of the building and pull out these big manila folders and leaf through them and look through them, and it could take hours. But what I was looking for was the anesthesiology records, because I knew that the anesthesiologist records from minute to minute heart rate, blood pressure, any movement, any suggestion that they might be coming out of anesthesia and gaining awareness. There was none of that. The anesthesiologist's report was quite bland, as it should be in a situation like that. And there was no suggestion that he had elevated heart rate, elevated blood pressure, any signs of distress. And the surgery went off quite well, and they removed some shrapnel, which was a reason for his surgery in the first place, and he did fine, according to our records. But Samuel did not think so. And so he refused the surgery. We made him comfortable. His family gathered at his bedside, and he crossed into the non-physical. And that stuck with me. That was a moment I could not wrap my head around. I had no context, I had no language, I had no experience. But something shifted, and I became aware of this phenomenon. I read everything I could about what I came to understand as out-of-body experiences, and at that time I didn't know about it. But Samuel's experience set the stage for me to experience what I was intended to. But quickly I was back into the training mode. But every now and then I would hear people's experiences and stories. And I became, as uninformed as I was at the time, of the impression that they all happened from this vantage point of above. That in moments of crisis, people would float up above their body, view their experience, float back down into their body, and awaken to tell me about it. And I heard some really great things, and one of them was really quite fun. You know, you have this impression when you are watching a cardiac arrest on TV that it's all chaotic and people are shouting and running and doing things, and that there has to be an element of drama about it for it to be successful. Not true. In the ICU, it's actually can be quite calm because we have them already hooked up, and you have the time to kind of sit in that space and respond to whatever emergency is arising in front of you. And it can be quite conversational, too, as you're waiting to see if your intervention has had an impact. So I had this one patient, and his name is long lost from me, but after we resuscitated him and he recovered a couple of days later, he began to tell me about me and what he saw. And he told me about my chartreuse green shirt, which I still have and love, and it's unmistakable. But apparently it looks the same from up above. But he commented on how that color glowed, and it was just so bright. And so he locked in on me because of that color. And he described to me the events that I knew to be true, we had kind of a humorous moment in the midst of his code where I got kind of tangled up in the bed, my stethoscope, as I was trying to pull it out of my pocket. Pins came flying out, and he commented on that. He said, there was so much stuff in that pocket, I thought a frog was going to come out next. But again, over the years, I had some experiences like this where people would come back and tell me, describe perfectly in a state outside of the physical, what had happened while they were in the physical, and we knew that they were experiencing cardiac death and couldn't possibly, by our definition, have described what they described. But a turning point for me came about 7 years ago. One of the ICUs that I work in the most is actually a trauma ICU. And that has become my home. It's become my space of comfort. And as you can imagine, there's a rich opportunity of stories there and experiences that people experience around trauma, which is probably why I love it so much. In Wisconsin, we have a lot of rivers, probably left over from glacier melt, but they're big, they're slow, they're wide, and they're perfect for recreation. And I will never forget Kyle, who was in his late 20s, early 30s, and quite active, quite in love with being young and being able to do all these spectacular things. And one of his favorite things to do was parasailing on the Wolf River. And there are two stories here, our version and Kyle's version. And what we knew to happen in our version is that Kyle was parasailing behind a boat on the Wolf River, and man brain set in when he saw two bikini-clad women sitting on a boat floating in the Wolf River. And so he was so enamored, flirting began, and there was a moment of bad decision-making on the nurse's part, because one of them was a nurse. They flashed him. Man brain went into overdrive, and he became tangled in some utility wires, not paying attention. So our version, he began to fall out of his glider, his parasailer, into the water. And he's pretty high up, so he hits the water with such force that he loses breath, he loses heartbeat, he starts to drown. And these two women, horrified, become his rescuer. They pull him out of the water, and one of them was a nurse, as I mentioned, and they resuscitated him successfully. Kyle's version. I was watching these two babes. I was having a good time, and all of a sudden I started floating up, and I thought, well, my parasail must be caught some wind, and I'm floating up. And he said, while I was floating up in the air, I saw this guy falling, and I was horrified. I thought, he's going to hit the water. This is not going to be good. And so he said he watched this man hit the water, and the next thing he knows, he's laying on the deck, looking up into the faces of, as he described it, these beautiful nurses. There were these beautiful babes. He didn't know one was a nurse. And I can only imagine that he heard celestial music of the Sports Illustrated type. And what was so fun about this story is that he gained so much insight, and he was so excited about what had happened once he realized what had happened, that the whole experience was not lost on him. In fact, he said, I am not afraid to die, especially if it means diving head first in two bikini-clad women. But I was in love. I was in love with the process from that moment on. To understand how transformative that moment was for him, on whatever level he could accept it and experience it and relish in it and grow from it, became so beautiful to me, I thought, I want more. And I set about trying to figure out how I could enter into conversation with people. And what I finally settled upon is a question that I would pose to them. And I was polite about it. I would let them recover from whatever it was that had caused cardiac death or respiratory death or whatever trauma, whatever illness, whatever had happened. But at some point, I would approach them and say, did anything unusual happen when you experienced cardiac death? Did anything unusual happen when you were in your accident and were resuscitated? And the first person that I posed that question to was a woman who, I asked the question, I said, did anything unusual happen? She said, No, and I was so disappointed. She was well-versed in the existence of near-death experiences. She'd read all about them. She was fascinated with metaphysical phenomenon of consciousness, and she was really, truly disappointed that she did not have a near-death experience. But we had this rich conversation about the fact that perhaps she didn't need it. Perhaps she didn't need that moment where her understanding of reality is ripped apart and she is invited to look at another possibility. The second time I posed that question was to a lady who 10 years earlier had experienced neurotrauma. She had had a head injury. She was hospitalized for a long time, and after that, something had happened. A flip had been switched where she was able to be incredibly intuitive. We've all heard these stories where after a traumatic incident you can perhaps have mediumship abilities, intuitive abilities. She had these things. She had this very rich experience. But what her doctors and her family told her is that, you know, you had a head injury. It was a very serious one. You almost died. So these experiences that you're having are probably just sequelae from this head injury. So she started to shut down. And these beautiful experiences, these rich experiences that she had were kept close to her, were unable to be shared, and that was extremely lonely for her and very sad. So when I asked her, after her cardiac death, she came in with a cardiac arrest, did anything unusual happen to you when you experienced cardiac death? She started to cry. She burst into tears, and she shared with me this beautiful experience of meeting light and pure love, and this sadness of not wanting to come back because she had experienced intense peace and acceptance. And she's sobbing through this whole story. And in that moment, I realized she didn't need the experience. She needed the question. And the question became very important and still remains something that's part of my tool set as I interact with patients. But then more often than not, I come across patients that need the experience and the question. They need the question from me to set the stage for them to begin to understand and process their experience. I had a patient who was quite ill, and in that illness, we understood that he had a faulty electrical system in his heart. And every time we would try to bring him to consciousness, he would have this storm of dysrhythmia, ventricular tachycardia, and he would become quite unstable, and we would have to shock him out of it, soak him in medication, let him marinate in the medications that we know can hold people in a stable rhythm. And this happened to him 4 times. And so he had 4 resuscitations during his long hospital stay, and these resuscitations were quite prolonged. I mean, we would stand at his bedside shocking him and giving him medication 30, 40 minutes at a time. But he survived. And I saw him in follow-up in the outpatient clinic, and he explained, he told me this incredibly rich story of how he was able to very easily get out of his body. And it only took him 1 cardiac arrest to realize that he could do this. And he would get bored laying in bed, I can imagine, and walk around. And if he saw a nurse coming, he would think, oh, I've got to get back in bed. And so he would get back in bed, and he would lay there, and he began to say that he could understand the nurse's thoughts. He could hear them. And with people he was very connected with, his family, he could hear their conversations over great distances and recount them to them. He could hear their conversations in the waiting room. He recounted a funny one where they were fussing over which store they were going to go to catch the sale racks because one had a better sale rack than the other, and if we get there early, we'll get the better deals. And he was able to recount that conversation to his family, who just stood there looking at him, unable to believe what they had heard. But the curious thing is that not only was he transformed by this experience, he had had incredible difficulty with vision and hearing. He had heightened sensory experience that lasted for about 3 weeks after he went home. He could see, he didn't need his glasses. He could hear, he didn't need his hearing aid. And as time went on, and it started to fade, he was trying to hold on to that experience in whatever way he could, but it changed him. And when I saw him in follow-up, and you're going to love this, I guarantee it, he said, I've been doing some research about what I experienced, and I found this place in Virginia. And he said, they seem to know all about what I'm talking about. And he said, and I want to go there. And so we had a lovely, I said, it wouldn't by chance be the Monroe Institute, would it? Yes, it is. It's the Monroe Institute. And so, I mean, obviously, you know, we're like this. We're connected. We're bosom buddies. So I've formed this ongoing relationship with them that has been quite beautiful. But again, a brilliant example of how these experiences can be transformed and how we need to be prepared to hold space for them and then ask the question and invite it forward. But you know, just like buying a red car, once you buy a red car, you see them everywhere. Once you name your child Katie, suddenly the world is filled with Katies. You know, this level of awareness that you didn't know of before suddenly is right there. And about 3 years ago, I noticed that people started telling me things without the question. And I imagined that once I had entered into that space, and once they had entered their space, that connection was probably obvious to them on some level that they didn't necessarily understand or recognize consciously. That they could this was safe space, they could tell me their experience without being judged and without being told that it wasn't real. And sometimes they're quite funny. I recently admitted a man to the hospital who had had a respiratory arrest from his emphysema. He had been found by his son. He was pulseless, he was non-breathing, he was blue, and he didn't know how to do CPR. So there was some time before the EMS got there, were able to resuscitate him. And you know, for time, oxygen, or the lack thereof, is brain. And so you always worry about a anoxic brain injury, but he was right as rain. He was perfect. And I walked into the room, and he was jubilant. And I walked into the room to introduce myself, and the first thing he said to me is, I saw my brother. Like, that's great. I didn't understand the context. He said, you don't understand. I died, and I saw my brother. So I'm all in. I'm all ears. I pull up a chair. I sit down, and I said, tell me. Tell me what happened. And he recounted this beautiful story of crossing over, being greeted by his brother that he loved, but had died tragically in an accident years earlier. And again, this pivotal moment of, I'm not afraid to die. It's okay. I know what's going to happen next. So as I'm getting ready to examine him, I pull the chair aside, I reach into my stethoscope, and he said, I know what's going to happen next. And I said, you're going to see your brother. He said, no, you want me to take a deep breath. You know, by and large, near-death experiences are quite positive. And what people experience is quite positive and transforming. But I am so glad that I asked the question. Because Carol told me an experience, a patient who had had a cardiac arrest, that was actually quite dark and quite frightening. And all of her fears of the afterlife came barreling in on her when she crossed over. She saw demons. She saw darkness. She saw agony. And when we resuscitated her, she was terrified. Terrified of dying, terrified of what it was going to be like, terrified of what she perceived was waiting for her. And so when I asked her the question, that's what she shared with me. And I remember reading something in a book that I got here about someone's experience of encountering this darkness when they would go out of body and have experiences of exploring out of body. And they tried to avoid it, but it kept pulling her. And when she finally engaged with it, she understood it was just a throbbing, undulating mass of her collective fears and anxieties and beliefs that did not serve her. And so I remembered that story, and we sat for probably an hour dissecting that experience of, what do you think that meant? Was anything familiar to you in that? Any fears that you have here that resonated with you in that experience? And so I was so fortunate that I had the time to sit with her and to unravel that, because she gained an understanding that how we are here is how it is there if we set up that script. I've heard people say, I don't believe in God. I don't believe in an afterlife. And I've found myself saying, once you cross over, you will find that that is true, because that's what you've decided is true. And so we were able with Carol to bring her back to a space, and I was able to share some stories with her that were brighter and lighter and more encouraging, that this, in all likelihood, was a script and a scaffolding that she had set up for herself. And that if she took the time to explore those fears and to untangle them and to set them aside and to refuse to keep their company, that I felt confident that when she crossed over for the final time from this earth body, that her experience would be quite different. Another experience I had recently that is, I'm still learning from this process. I'm still being informed by what people experience. There was a woman who was dying, and we knew she was dying, and it was clearly her time. There was nothing that we could do to save her, but she was quite conscious. And she had a son who had been quite naughty, and he had done some things that were just so unkind to his parents and alienated himself from his parents. He had spent some prison time for theft related to how he had really destroyed their financial lives. And so there's a lot of hate and animosity that existed between them. And her son wanted to come visit her on her deathbed, and she said, no, I don't want to see you. And of course, he's older, he has more experience. This is now 25 years after the fact, and he really wants to connect to his mom. And he's sitting in a bar. We've got lots of them in Wisconsin. And he's experiencing deep sorrow, deep regret, deep remorse, wanting to connect with his mom before she crosses over. And she's refusing to see him. And he's wanting this so badly. He looks up, and he sees his mother coming into the bar. And he's so shocked, and he's so elated. He's crying. He's excited. And he can't understand it because she's so sick. What is she doing there? And he gets up to go greet her, and as Wisconsin bars are always so crowded, there are people that obscure the view, and when they pass, she's no longer there. His mother wakes up and says, I had the strangest dream. I dreamed that I was in a bar, and I saw my son sitting at a table crying. And he got up to start coming to me, and I got scared, and I woke up. And we were able to corroborate these stories and understand that her higher self, and this is how I see it, because unfortunately before she passed, they were not able to make that physical connection, but I believe they made that soul connection. And he was blown away, the family was blown away, because they understood that something quite unusual had happened, and they were able to share the same data to confirm that this was true. This is a fun one. I liked what William Buhlman said about throwing out an anchor and keeping yourself firmly entrenched in a reality. And we come across that. I had a lady one time who was incredibly ill and bound to her hospital bed by every cord that mankind can invent that has utility in the ICU. She had a Foley in her bladder. She had a tube in her throat connecting her to the ventilator. She had IVs. She had lines. And she was quite ill, but we knew that she would probably not die from this illness. So when she recovered, she was furious. She said, your staff is horrible. I tried talking to that nurse and telling her I had to go to the bathroom, and she would not listen to me. And she was right there, and she kept her back to me the whole time. I know she could hear me. And she was just ignoring me. So I got frustrated with all you people. I had to go to the bathroom, so I got up out of bed and started looking for a bathroom. You don't have a bathroom here in the ICU. Did you know that? And I went over to Sally, and she described Sally. And Sally is our administrative assistant in the ICU. She described her perfectly, who was not on duty the day that she woke up and was telling me this story. And I asked Sally where the bathroom was, and she ignored me. And so I went out the door to the ICU, and I wanted to say, did you open them or go through them? And I looked around, and you just don't, this is a sorry institution. You don't have a bathroom anywhere for use of the patients. And I'm going to file a complaint. And she did. She filed a formal complaint. And the nurse manager that I know very well of the ICU, she came up to me and she said, I knew this could only be your patient, Laurin. And I was talking, I engaged this patient in conversation in language that I felt that she could accept and understand, suggested to her that maybe she had had a non-physical experience, that maybe she had had an out-of-body experience, but she did not have the context to even register that. She did not have the experience. Her anchor was firmly out in this physical reality, and that is how she interpreted her experience, to the point of putting ink to paper to tell us how bad we were for not having bathrooms in the ICU. Another one that is really quite charming, and this is just an example of many. We were sitting, I wasn't, on the night shift, things can kind of quiet down and be quite controlled and peaceful, even in the ICU. And nurses were sitting out talking, chit-chatting, and we received another complaint of a guy who did not feel that his needs were being met and couldn't get the call light to work. Must be the batteries needed to be changed. And so he came out to the nurses' station and he started talking to the nurses. They didn't listen to him. He tapped him on the shoulder. They didn't listen to him. And he's thinking, these nurses are just so inattentive. I've never seen anything like this in my whole life. So he sits on the counter and said, I'm going to sit on the counter till they notice me. And they never noticed him. So he went back to bed for lack of anything better to do, understanding from our perspective that he's so hooked up he can't even possibly turn over, let alone get out of bed. But again, explaining to him that reality, his anchor's firmly down, he can't conceive that this is even possible. What I've encountered recently as I continue to grow in this journey and to evolve how I interact with patients is understanding that there is a truth that exists for patients around these experiences that has nothing to do with our belief in them or lack thereof. They exist independently, and they don't need our belief in them to be true. They don't even need the patient's belief in them to be true. I had a patient who I was seeing again in follow-up, because this tends to be where I am able to hold space and receive these stories. But this woman had been in a very bad accident and had broken both of her ankles, and they had to extract her from the car with the jaws of life and all the drama that goes into trying to get someone untangled from mangled metal. And her children brought her to see me. They came to the follow-up, and they said, basically, we want you to set her straight. She's telling us a story that we knew was impossible to happen. And my immediate thought, though I didn't say it, is you picked the wrong doctor. If you want me to set her straight about an experience that she says happened that you don't believe did. But what she told is that she is the eternal mother. She's the driver. She's stuck in this car, but that doesn't even register as a possibility for her. Speaking of the impossible, it doesn't even enter her mind that she can't get out of this car and assess other people and see if they need anything. So she gets out of the car and she's walking around checking on people to make sure they're okay, and then she hears the sirens and thinks, well, I better get back in the car so they can take care of all of us. So she gets back in the car and she's excited about this phenomenon because at some point she realizes, wait a minute, if they had to get me out of the car, how did I get out of the car and walk around? So she's processing this at home. I mean, and all of a sudden she's kind of in love with this story of something fantastic happened to me and I'm telling everybody. And her kids aren't buying it and they become annoyed. They become irritated by this phenomena that becomes her deep truth of what happened. And so we end up having a discussion, and quite a nice discussion, where they still don't believe it, but we come to an agreement that she experienced something that she cannot prove to you that happened. You're hearing something that you cannot prove to her that did not happen. So in this middle space, let's agree to honor her truth and to hear her, and when she wants to talk about it, do you think that you could hold space to hear her story without passing judgment? Because obviously this is something very important, very transformative that happened to her, and they were. They were okay with that. And I haven't seen her in 4 years now, so I don't know if they have been transformed by osmosis of hearing her story over and over. I would hope so. Another one that happened that I think is just quite fantastic is a lady who remained conscious throughout her entire accident. And that's recorded in the EMS documentation, because frequently you have this traumatic event, you're thrown from your car, you lose consciousness, they wake up in the ICU, you talk to them, they have no idea what happened. The last thing I remember is something was coming at me, or the last thing I remember is I was slamming on the brakes. There tends to be this protective veil that descends over trauma, and you don't remember it. But this lady had been thrown from her car, and then she starts to explain, with tears streaming down her face, I saw my mom. I saw my dad. And they hugged me. And she's choking sobs, so these are these simple sentences that she can get out in this high, squeaky, tear-filled voice. And she's crying, I'm crying, the nurse is crying. I mean, this is just so beautiful. And her son becomes very irritated. He said, that didn't happen. And he's angry. I mean, he becomes, and the more she tells this story, the more angry he becomes, to the point that one time I asked him if I could have a moment with him out in the hallway. And so we have this discussion about truth. And this is her truth. And I asked her, what is the most important thing in this situation? That she stopped talking nonsense. That's what he said. And I repeated the question. I said, no, what is the most important thing here? And he was finally able to come to the point that my mom get better. That's the most important thing to me, that my mom get better. And I said, what if this experience that she had that has her so emotional is part of her getting better? What if her being supported in her truth, even though it's not your truth, is actually part of her healing and part of her road to recovery? And he was able to enter again into what was him an uncomfortable agreement that we would support her truth. Because as I've gone through this process of being informed about near-death experiences, out-of-body experiences, other phenomena of consciousness around people who have experienced trauma and illness, is that they're there to teach us something. They happen more than they realize, and hopefully as we learn to ask the question, we will be invited into these experiences, and hopefully as care providers gain some skill in helping them interpret that experience, their interpretation, not ours, and help them to get as much from that experience as they deserve to get. And so that's my new passion, is how can we train physicians, train nurses, train healthcare providers, mental health providers, to enter into a conversation around their truth. Because what I hear now, and I actually heard it from a doctor on NPR not too long ago. I was listening to this guy who is a well-known author, well-known physician, and I was really into what he was saying because he was talking about the cutting edge of medicine. And if you listen to public radio after they have a presentation, you know they have a call-in session afterwards. And so this person called in, and he's explaining his near-death experience over the phone, and I'm really excited. And this esteemed physician across the airwaves said, well, you have to understand that you were really sick. Yeah. And he essentially shut him down on public radio, telling him it didn't happen, telling him that it didn't exist, and that it was probably a hallucination. And I was mortified. I turned the radio off. I was shaking. I couldn't think. But what came out of that for me is that there is a sense of urgency to educating physicians that it does not matter if you believe in it or not. Your agenda around near-death experiences and phenomena of consciousness is so unimportant. What is important and what is central is what the patient in front of you experienced. So I'm going to ask Brian to switch over to a video as I tell you a story of how this video came to be. And I really feel strongly that this work found me. It started with a curiosity, but I'm amazed at what is, once I open that door, what is coming my way. And the invitation to be part of this conversation around educating providers about what our role truly is, and that it really is a medical tool to be able to sit there and hold space without judgment and without interpretation. When I did Heartline in 2010, I met a lady there who is a filmmaker, and she's also a member, very involved member of IANS, the International Association for Near-Death Studies. And synchronicity being what it is, she and I came together and she started telling me about her project, and I started telling her about my experiences. And she said, would you be willing to be interviewed for this project that we're putting together on how to educate physicians about how to talk with people about their near-death experiences? And I said, sure, and didn't think anything about it, and time went by, and I didn't hear from her, and she didn't hear from me, and it just kind of faded away. We had a local chapter network retreat that summer, and she and her husband came. Roberta Eller is her name, and she has a production company called Blue Marble Films. And we started talking again, and it was this moment of, she had kind of forgotten, I'd kind of forgotten, and we saw each other, and we said, oh yeah, we were going to do that thing. And she said, well, I have my equipment here. I can set it up, and we could do the interview right now. We were at the Nancy Penn Center, and we realized this was probably not the best environment. So one thing I know about Penny is that she is always up for anything that might be a little mischievous or out of the ordinary. And so she agreed to drive us up to Roberts Mountain Retreat. And while we did filming and set it up, Penny set about doing Penny stuff, which, I learned on Sunday night that she's a stuffologist. So that makes perfect sense that she would be doing Penny stuff. But in retrospect, I consider being the being that Penny is, that she, without even knowing it, probably held incredible space for us while we did this interview. And it became part of a film, and the film is out now and is being distributed to physicians and nurses and mental health providers who are willing to listen. And our hope for this film is that it will gain some momentum to introduce a new way for providers to interact around patients who have had experiences of consciousness phenomena and become comfortable in asking the question, and to understand that there's no pressure for them to believe in it because their belief in it is irrelevant. Their ability to show up and ask the question is central. So this film is about 30 minutes, and I'm going to watch it with you, and then afterwards, I'll open up the floor for questions, so I hope you enjoy it.
When a patient has a near-death experience, how do you recognize it? How do you respond to it? A new training video provides answers to these questions. These 4 patients have all had near-death experiences, also known as NDEs. Most caregivers know little of this phenomenon because patients are often reluctant to talk about it, and few programs deal with this aspect of patient care. In many cases, medical professionals' lack of training has led to patients being ignored, mislabeled as psychotic, or inappropriately medicated, sometimes with devastating consequences.
I think the doctor's responses really impacted my healing. What did I have? Did that ever happen to anybody else? I needed to know that.
Well, several studies have shown that near-death experiences occur to between 10 and 20% of people who are documented to come close to death, for example, with a cardiac arrest.
Some of the common characteristics of near-death experiences Our people feel a sensation of coming out of their physical body, possibly being up at the ceiling and watching and hearing everything that is happening before them.
I was translated, immediately propelled, immediately into the light.
Because I got the input I did, I wound up cramming it psychologically. And you know, you can't cram psychologicals. You can for a while, trauma, but it's going to come out.
And I would have said, pay it no mind. And of course, I now realize I would have been absolutely wrong.
The NDEer sometimes shuts down and doesn't disclose the NDE again, sometimes for years.
One of my hopes is that we can raise awareness among providers about the fact that this phenomenon does exist. Whether it's something that we can prove scientifically or not actually becomes quite irrelevant. It is a subjective experience that the patient has that we need to honor and provide an invitation for patients to process that.
And in fact, our whole world will be much better off as we kind of take the lid off and allow people to report what they go through in these kinds of mystical journeys.
This groundbreaking video features 6 medical professionals, addresses the needs of near-death experiencers, and provides professional and general audiences with knowledge of NDEs. Get a copy to share with your family, your doctors and nurses, your church and your community. It will help transform their understanding of near-death experience. A training package is also available for hospitals, medical schools, nursing programs, hospice, and other organizations. This training package includes the video disc, plus a PowerPoint presentation, discussion questions, role-play scenarios, reading lists, brochures for caregivers and experiencers, as well as other training materials. Order online at www.iands.org/video or call 919-383-7940.
One more question?
Okay. I really like what the movie has to say, but when I was 20, I had an operation on my knee, and the same thing, what happened to me was I was watching the surgeon cut into my knee, and I started to scream because I thought it was going to hurt, and I was very surprised to find out that it didn't hurt. And I shared it with my orthopedic surgeon afterwards, and he totally discounted the whole thing. I was in a teaching hospital, and one of the residents actually did the surgery, and I told him that one of the residents did the surgery, and I identified him, and he still didn't believe it, he still discounted it. I don't believe I had a near-death experience, but I guess that's the only thing that disturbs me about this is it's all categorized as near-death, when in fact it was just my consciousness left my body. And one thing that helped me get some closure with this is Laurin had put a story in the LCN newsletter in the last newsletter, and I didn't even realize until I read that story that I couldn't have been in a position where I was watching unless my consciousness was out of my body, because I was observing my knee and I was observing my knee being cut, and I was in no position to see that, only if I was up looking down. So I really got an appreciation for that, and I want to thank you for that.
In closing, I do want to say one thing, and I agree with you, Fred. Thank you for bringing that up, is that we observe and experience so many phenomena of consciousness in the context of trauma and illness. Our current limitation of language in this video does talk about NDEs, but I feel like that is part of my personal journey, is to help expand that conversation as wide open as it can be expanded to include other experiences.
I think we all can agree that Laurin Bellg is really expanding the language and helping a lot of people, and that we were very privileged to have this presentation. Thank you. Thank you.